All right, just want to be mindful of everyone's time, so we'll go ahead and get started. My name is Melinda Southard, and I serve as a Deputy Director here at the Nevada Health Authority, and I just want to welcome you all to today's webinar about the Rural Health Transformation Program, specifically the Workforce Recruitment and Rural Access Program, otherwise known as WRRAP initiative for rural medical residency programs. And our RFA that is out. So with that, we'll go ahead and get started with an agenda. So today's webinar is meant to provide a summary of the request for application open funding opportunity that's available for the WRRAP Rural Medical Residency Program. So we'll just give a quick overview of the Rural Health Transformation Program just to level set. And then we'll go into the funding opportunity itself. We'll talk about some application requirements, scoring criteria, post-award requirements, and then, of course, what all is needed for the submission. All right, so we'll get started with a quick overview. So many of you know by now, I'm sure, that the Rural Health Transformation Program, why it exists and what it strives to do. We're basically, tasked to focus, of course, on rural and frontier community. Uh-oh, my slides went away. Stand by. Okay, so we should be good now. Sorry, folks, technological glitches. All right. So Nevada was awarded a 5-year cooperative agreement from the Centers for Medicaid and Medicare Services to modernize rural health infrastructure. We were awarded nearly $180 million for this first year of the program. And Nevada has chosen to use separate funding opportunities that are called RFAs, or requests for application, to be able to distribute the funds in a flexible way and expeditiously, of course. So the funding opportunities are for this first year only, so years 2 through 5 will be subsequently released. And if everyone wouldn't mind, please muting their mics so that we don't have any feedback or background noise, that would be great. Thanks so much. All right, so today's webinar is going to focus, of course, as I said, on the Workforce Recruitment and Rural Access Program initiative. It's one of the 4 initiatives that Nevada has to strengthen rural healthcare in our state. The WRRAP initiative is for immediate and long-term provider gap strategies, including incentives, training, and workforce pipelines. Now we'll talk about the funding opportunities and eligibility. So for the Rural Medical Residency Program, the purpose of this program is really to create or expand rural medical residency programs throughout the state with an emphasis on primary care or family practice residency or specialty fellowships that are designed to train frontline rural physicians in the areas of geriatrics, maternal, or behavioral health care. And that would include also specific retention strategies. So the funding that's available under this RFA announcement is almost 2 million. And we do include kind of a tiered funding approach when it comes to trying to strategize how you want to submit your application, your proposal, your project. We wanted to give just a couple of different guidelines for when you're thinking about the different projects that might align with this funding opportunity. And hopefully it provides some helpful guidance. So I'm going to go into those tiered approaches here really quick. All right, so in the RFA itself, you'll note that we tried to kind of provide these different tiered approaches towards thinking about different projects that might be aligned with this RFA. Some of those projects are going to be smaller and some of them are going to be bigger, and they would request more funding with those larger projects. But your tier 1 is kind of geared towards the planning and the small residency expansion. So these are, be like a planning grant award, basically. An estimated funding range for a planning type grant under the Rural Medical Residency Program would range from about $150,000 to $400,000 in the ask. And so just kind of giving, these are not hard set numbers, but they are meant to provide those guidelines for folks when they're applying. And then tier 2, You're getting into rural medical residency program development, so more than just planning, right? Now you're actually developing the program. And then tier 3 is the rural or the regional residency and fellowship program. So thinking about those larger programs that might encompass multiple partners in those regional programs, and just a lot of different collaborations that might be involved there. And then, of course, tier 4 is the largest. That would be a very comprehensive rural GME initiative. So something extremely large that would encompass several regions of the state potentially, or several types of GME programs, which we'll get into a little bit here. And again, we have $25,190,425.12 available in this RFA opportunity. All right, so now let's talk about eligibility and the use of funds. So this is pretty standard across several of our RFAs, or these cost categories. So we did provide, allowable cost categories of personnel, travel, training, operating, your standard cost categories that you would ask for in a grant award. We also allow for, program-specific incentives and supports as long as they're tied to the approved scope of work. And administrative expenses are allowed, but only within that 10% cap. And please note here that indirect costs are not allowed through the Rural Health Transformation Program in Nevada. And then we have some key restrictions. So again, these are across all of our RFAs, is that, no pre-award costs are allowed. There's no construction that's allowed. Of course, no supplanting of existing funding, and no profit above allowable costs that are outlined in the RFA. Also, no duplicative payments for reimbursable clinical services, no clinician salary or wage supports where non-compete limitations apply. So if any physicians are held to those non-compete clauses, they would not be eligible for any salary or wage supports. And no capital improvements without prior written approval, and no prohibited telecommunication or surveillance equipment. Specifically for the Rural Medical Residency Program, resident and fellow program costs, such as staffing.
I get about $150 a day.
Program costs. Student stuff.
Melinda, you're muted.
Okay, here we go. Sorry, folks, we're just having a time today. All right, I'm going to go ahead and move forward. So the last thing I touched on was that example for rural medical residency program and those allowable costs in that far right box. Okay, here we go. So who can apply? So who's eligible under this funding opportunity? So we did allow for private, nonprofit, governmental, and for-profit academic medical centers, universities that offer medical residency programs, and other medical teaching institutions that are located in rural and non-rural areas, but they must offer at a minimum training programs for at least one of the following, and that would be physicians, nurse practitioners, or physician assistants. Applicants that are not located in rural areas must include strategies to recruit individuals from rural areas and provide placement for individuals in rural healthcare settings and practices. So some of the different priorities that we have established for different applicants would be, starting with provider types. Like, as I mentioned, the training programs have to be for at least one of these following three. So physicians, nurse practitioners, and physician's assistants. Applicants may expand beyond those three provider types in their application. You can include additional categories that would be, more of your physician extender type professions, but the three above, those three listed professions are required. Location. So programs that prioritize addressing a rural medical residency need and placement in specific rural geographic areas that include these counties in particular, as well as our frontier regions of the state and tribal communities within these rural counties. Different program priorities. So additional priority will be given to applicants that provide primary care or family practice residency or specialty fellowships designed to train frontline rural physicians in the areas of geriatrics, maternal, or behavioral health care. With specific retention strategies, as 50% of the positions that are funded under this proposal have to include these provider types and practice area. So that was a priority of the Nevada Health Authority when we submitted our application to CMS and they approved it. And so here it is in practice in the RFA. So next I'm going to go over some of the requirements of the application itself. All right, so we have several components that are required for each application to be considered complete. So we have the cover sheet, budget narrative, budget plan, project narrative that includes a work plan template, and letters of commitment may or may not be required depending on what type of applicant you are. Additionally, we have the administrative requirements. So all of our subawardees eventually will have to be registered as a state of Nevada vendor to receive funds. So we would encourage all applicants to apply for that vendor status now, just to expedite that process should you be chosen to be awarded funds through this opportunity. And we want to make sure that we are able to get that subaward signed and executed as quickly as possible so you can all get to work. And then, of course, applicants should use headings and subheadings and respond to each narrative question individually. There is a minimum of 3 SMART goals with at least 2 objectives each in the work plan template. And of course, incomplete and ineligible or non-responsive applicants may be disqualified before scoring. All right, so now I'm going to go into each of these components. So the cover sheet. We did provide a template for the cover sheet for everyone to use. Make sure to complete all the fields. Be sure to specify the funding opportunity you're applying for. And this cover sheet would include all of these components that are listed over here in the attachment A box. So the cover sheet is also known as attachment A. And ensure that you, again, complete all those fields and address all of those components. Next, we have the budget narrative. So the budget narrative is really important, right? It explains how each cost supports the project and the outcomes. So personnel costs that are being requested in the RFA must include a salary basis, level of effort, months charged, and role justification for that line item. Travel always has to follow GSA rates and must show the destination, number of trips, dates, and who is traveling for each of those. Consultant, contractor, and subrecipient costs are allowed, but they must include scope, period of performance, selection method, accountability, and itemized justification. Those are all really important points because CMS requires all of that from the state when we do submit subawards. So we have to provide all this information to our federal partners. So we're asking for all that from you as well. And then, so the attachment B, you have to explain the costs in all of the cost categories where you are requesting funding. So any funding that you're asking for should be included in one of these cost categories. If it is a cost category that is not listed here, then it would be ineligible for funding. And again, funding for years 2 through 5 is contingent upon CMS funding and, of course, Nevada Health Authority discretion. So this RFA is for year 1 only. However, if you have plans to continue this program in future budget years, we would ask that you include that information in your proposal. But year 1 would be the only year that we are authorized to provide funding for. Next, we have the budget plan, otherwise known as attachment C. Again, here, indirect costs are not allowed, but we do allow administrative costs only up to 10% of the entire request that's being requested through this funding opportunity from the applicant. And we do not have any match requirements. Again, as I mentioned, for phase projects, please separate out those budget period 1 activities, goals, outcomes, and expenditures from any later planned phases of the project. Subawards will be reimbursed monthly, and any budget changes will require advance approval from Nevada Health Authority. Again, we do have the 5-year service commitment that we'll go into in a little bit as well, because it's tied with the WRRAP initiative very closely. All right, project narrative. So the project narrative has a few different components that are weighted accordingly with a different point values. So some of the required components of the narrative include the needs assessment, a work plan and impact analysis, data collection and evaluation, and sustainability plan. So applicants want to ensure to address all of these areas in their project narrative in the way that's, requested in the RFA guidance. And again, the needs assessment has 10 points. So all these points are very important because that's how the evaluation committee is going to score and eventually determine who is funded. So just encourage you to, read those instructions thoroughly. If you have any questions, please do reach out to our email address, which I'll have a slide at the very end that has that email address on there. But we do respond to all of our inquiries and try to post updated Q&A documents that include all of these questions on our website every Friday. So with the project narrative, we do have some guidelines. We have a maximum of 20 pages because our evaluation committee does not want to be reading applicants that, are hundreds of pages long, as you can imagine, I'm sure. This should be double spaced in Times New Roman 12-point font with 1-inch margins. Please use headings and subheadings so that we can follow along with your application and all of the required elements that are in the RFA easily. The work plan, again, requires at least 3 SMART goals and 2 objectives per goal. So letters of commitment are not required for non-rural and out-of-state applicants, but are encouraged. So for the needs assessment, so now we're going to break down little parts of the project narrative. Needs assessment, what's required there? So really here, we're looking for a very clear and concise overview of the need. How are you going to address this need in the area that you're intending to service with the increased residency, fellowship, and training placements? And we'd also want to be notified of current barriers by provider and specialty. Make sure to use data to show high need provider gaps and geographic input, and be sure to address local contacts. It's very important. Additionally, implementation barriers, and address the urgency of the intervention that's being requested. Next, we have the work plan components and impact analysis. So both the narrative and, well, actually the work plan requires a detailed program description because we want to know, what your program is. It's helpful to have that detailed description there when the reviewers are looking through these applications. Overall program strategy that aligns but does not supplant other workforce programming and funding. Very important. Also, if there is a 5-year service commitment that would be tied to any of the activities within the project, there needs to be an attestation for that where required. And we'll go into that 5-year service commitment in a little bit here. Also demonstrate how the work plan ties back to the needs assessment. So how what you're doing ties back to the demonstrated need in the community. Also include an org chart for those that are overseeing the program and a list of partnerships that will be used in the program. And then again, at least 3 goals with 2 objectives per goal. For the impact analysis, we are looking for an estimated impact of the program. So what, once this program is implemented, what do you expect to see? What's the, light at the end of the tunnel, if you will? So this is looking for table-based format with the following. So we really want to see numbers here. So number of healthcare providers estimated to be enrolled in the residency program, including specific provider types. So including physicians, nurses, physician assistants, behavioral health, and other providers that are itemized by specialty. Because again, this opportunity is not just limited to medical doctors. So also looking for a number of individuals enrolled in the residency that either might be or are required to adhere to the 5-year residency requirement. And then that impact must be updated and reported upon quarterly. So we'll have, with your subaward, you will have a quarterly reporting requirements as well as an annual reporting requirement. So the 5-year service commitment. So as many of you know, this service commitment is by federal statute. It requires the 5-year rural service commitment as a condition of any rural health transformation funding where it's required. So I guess there's a little asterisk there. CMS did put out a nice fact sheet that is linked down here that has more information about, how that service commitment is defined, who might be required to adhere to that, and a few other details. So again, here it is the responsibility of the subawardee to track, report, and enforce adherence to the 5-year service commitment requirement. I'm going to go over a little bit more about what that includes here. All right, so obviously people have a lot of questions, right, when it comes to the 5-year service commitment. So when does it actually apply? So 5-year service commitment in rural areas applies when an individual receives something of value specific to that individual. So these are things like tuition support, housing assistance, relocation incentives, stipends, or recruitment and retention bonuses. It also applies when the support leads to credentialing, a degree, licensure, or a direct rural clinical job opportunity. Okay, then when does it not apply? So it would not apply to more broader workforce infrastructure. So these are things such as, if you're purchasing training materials, if you're looking for faculty or preceptor support, added residency slots, and facility improvements. Also, it does not apply when the general pathway support does not directly provide an individual credential, degree, or job enabling incentive. So that would be areas that it does not apply. So how is the commitment satisfied once you find out, okay, it does apply in this situation? So the service must be performed physically in a rural area within the same state. So you can't have somebody, that's tied to this commitment serving 3 years in Nevada and then they decide to go 2 years in Arizona. No, it has to be all within the same state. And telehealth from an urban area does not satisfy this requirement. You have to be physically located and providing services in rural Nevada. Time, however, can be combined across multiple rural sites within the state. So, you can serve a few years in Hawthorne and then head over to Ely. And that would all work to satisfy this 5-year service commitment. So CMS enforcement and reporting. The important thing to note with this service commitment is that CMS has the right to recoup funds from the state, which the state would then recoup funds from the subrecipient if the prerequisite education or credentialing is not completed or if the 5-year obligation is not fulfilled. So states have to maintain our internal controls, and again, subrecipients should also maintain those internal controls and reporting to ensure the adherence to that 5-year commitment when it does apply. Now moving on to data collection and evaluation. All right. So there is a lot of data reporting required with the Rural Health Transformation Program that will all be itemized within subawards. And the measures that are indicated in the impact analysis should be part of the overall program evaluation. So everything that you're measuring should show how the program itself is moving forward. And so some of the things that you want to think about when you're writing about data collection and what types of measures that you're going to report on. So think about how you can actually measure the success of the program. And again, how are you going to know if it's successful? I mean, is it successful if everybody has a smile on their face, or that we actually have 10 more medical residents in this particular area? So just some different things to think about, like how will you know that it's successful? And then how will the program improve health outcomes for rural Nevadans? Because that's really what the heart of what we're looking for is. We're trying to improve health outcomes throughout our state and primarily in rural Nevada with these funds. All right, so project narrative sustainability plan. We've talked a lot about sustainability with Nevada's Rural Health Transformation Program. These funds are one-shot funds over 5 years to really transform how we do healthcare in the state. And we want to ensure that that keeps going and provides a lasting legacy. So it's really important for all applicants to speak towards how this program is going to maintain sustainability. So, identify how you're going to fund the program after the funding ends through the grant award, and describe those long-term operations, partnerships, and, just continuation of the program itself. Letters of commitment. So, proposals may be supported by strong letters of commitment or a memorandum of understanding from local, rural, or tribal health officials, rural hospitals, and other rural healthcare providers of services located in the community impacted by the proposal. So the service area, right? Like that's where you want to have your letters of commitment or MOUs. And again, the letters of commitment or MOUs do not count towards that 20-page limit. So we want to ensure that folks have the ability to provide those where necessary. Now we get into scoring. So how's the application going to be scored? So as we mentioned before, each of these components of the application is associated with a points value. The budget narrative itself is 15 points and budget plan is 15 points, making the budget in its entirety 30 out of 100 points. Project narrative is 70 out of 100 points. So these are very important components of the application, not to say that any is more important than the other, but they all carry a very good amount of weight when it comes to understanding the application itself and the actual benefit to rural Nevada. So an evaluation committee is going to review and score all proposals using the HRSA scoring criteria as noted in the RFA itself. So I think the very last page of the RFA should be that HRSA scoring criteria on that 100 points scale. So again, these are cut up into different categories, right? Depending on the score of, if you're really shooting for an outstanding application, it should be very fully developed, well supported, and above baseline requirements. If an application is poor, that would be an application that has some major gaps and deficiencies that really undermine the implementation of the project. So thinking about these things when you're writing your application is important. And the letters of commitment are not scored here, but they are encouraged. Now looking at post-award requirements. So say you've been successful in your application and you're now looking at a subaward. So now we're talking about reporting. So monthly fiscal reports and quarterly progress reports will be required until the funds are fully expended. We will also require annual fiscal and progress reports, and a final evaluation will be due within 30 days after the spending period concludes. And this kind of aligns with our state reporting to the federal government on the progress of our RHT program in the state. So it's really important. Like the reporting is extremely important because it helps to tell the story of how these funds support and impact lives in Nevada. So some of the details that we will need for these reporting requirements include baseline and then progress, right, for the provider counts in rural Nevada by those key provider categories. And remember, each program that is asking for funds under this opportunity has to address at least one of those first 3 bullets: physicians, nurses, and physician's assistants. And then other professionals such as behavioral health professionals, geriatrics, or maternal health professionals can also be included, but the top 3 bullets are the ones that are required. Also want to report the number of trainees that are enrolled and placed by their specialty types and provider settings. And of course, be prepared to provide any supporting documentation that's requested by the Nevada Health Authority, because again, we need to be able to tell the story to CMS, and we can't do that if we don't have all the documentation available. All right, so now let's look at submitting the RFA application. So round 1 applications are due June 26th by 11:59 p.m. This program has 25.19 million available in budget period 1, and our final decisions for this opportunity are estimated by August 16th of this year. So we will let every single applicant know if they were funded or not. So that will be sent to the primary point of contact listed on the application itself. And just to give you an idea of the timeline, so we released this RFA May 7th. We have those applications due June 26th. Then we estimate to get our final decisions out by August 16th. And looking to hopefully be able to make those subawards around August timeframe of this year. Those subawards will go through August 30th of 2027 because we, as a state, we have until September 30th of 2027 to fully expend all the funds. So the reason we do that is because we still need that 30 days to basically close out all of the subawards and draw down the funds to be fully spent out for that budget period by that September 30th deadline for the state. On the left-hand side of the screen here, there's that email address that you all can send your questions to, and we'll be happy to answer those for you. And we also included a link for folks to go to get that vendor registration to be able to receive funds through this program should you all be awarded. All right, so in summary, make sure to choose the opportunity that best matches your project, right? Very important to anchor every single request in a documented rural shortage area, a credible work plan, and a sustainable implementation approach. Those are very key and important to this program. Make sure to make the budget traceable, the partnerships real, and the service commitment terms explicit. Extremely important. All right, and now I've been talking a lot and really fast, and I hope it's not too fast. So I would invite you all to ask questions at this time. If you have questions, happy to answer those for you guys. I do have 2 colleagues from Milliman who have been helping us so much on this RFA that are available if you all have questions for them too. So with that, I will pause and stand for questions. All right, Michael Bautista, please go ahead.
Thank you, Melinda. We have a question regarding the non-rural eligibility. So for those, let's say, healthcare systems that are in the urban areas, they would have to propose their residency program focusing in on those rural regions to implement that rural track.
Correct. Yes.
Do they need to provide like a partner in a rural track, or just describe how they're going to implement that rural track?
So I think it would be helpful if you had a partner identified already to be able to provide that information in your application. If you don't, a very strong justification in your application and solid plan for how you intend to do that will be also important.
Thank you.
Sure, thank you.
There's
Any
a
other
comment.
Questions?
There's
Oh,
one
yeah.
comment in the chat, Melinda. If we're unsure of the correct initiative to apply to, can we ask to the RHT email address?
Absolutely. We are here to help. So if you have a conundrum with which opportunity to apply under, we can certainly help to not necessarily say you should apply under this one, but maybe offer you some guidance that will help you make that decision. Yeah, Michael.
Sorry, we have another question. Regarding that 5-year commitment, that is the commitment of the provider, not the subcontractor with the state, correct?
Correct. So that would be the provider that is receiving the direct individual benefit.
So if they do not meet that commitment, that's between that provider and the state and CMS should then recoup those funds, but it wouldn't be the health system or that subcontractor with the state, correct?
Actually, it would be through the health system or whoever the primary subrecipient is of those funds. And
So-
Andrew, if I'm saying that incorrectly, if you can help me with the
No,
clarity.
you've got it. I think there's a couple different ways to think about it. The 5-year service commitment applies when an individual is a recipient of funding that is like directly tied to their continuing to participate as a provider in that area of the state. It does need to be in rural areas that person is providing services, and that timeline can be non-continuous. But as Melinda mentioned earlier, the obligation to track and monitor that individual's the application of that time commitment is on the organization that is the subawardee in this instance. So that, I think, is a process that the state and the subawardees will work out as time moves along. But ultimately, it is the subawardee's responsibility to track.
To track, but not to recoup.
I mean, on a recoup, I think that in that instance, the state would need to reach out to CMS and find out exactly how they would go about overseeing that. But again, if there's any issues with ensuring that individual is or is not, completing that commitment, I think that's something that the state would likely be considering how CMS would like them to respond or react in those instances.
Okay, thank you.
Thank you guys. Great questions. All right. Any other questions from folks? Last call. Gerald, did you have a question?
I did, and I apologize. I got an emergency call, so I had to jump off. So for about the time you started the question, so if you've answered this question, just tell me and I'll look at the recording. So if you're building the residency or fellowship program, but you're not paying the trainee with rural health transformation funds, you're doing the infrastructure, you're doing the faculty, et cetera, that should not be a 5-year commitment on the trainee, or would it, because rural health transformation funds are being used to support the activities of building that residency or whatever that is within that rural community? And if you answered that, just tell me.
No worries. I did not answer that. So that is basically the gosh, I'm trying to make this as clear as possible, but the example that you provided, you're correct. That resident would not be subject to the 5-year service commitment because they're not receiving that individual direct benefit.
Okay. All righty. Thank you.
And I think just to address, I think the first component of your question, yeah, if you're setting up programs using the RHT funds, and that's like for the kind of development of the program and not for the benefit of an individual, like through a salary or through an incentive, then those expenditures used to set up the program would not have a 5-year service commitment attached to it.
Well, and I guess my other question is, because most of these sites are, will be applying for GME funds for ongoing support to continue the residency program. There's no funky rule that they've gotten written in there. The that if they're tapping into those GME funds, that's going to do anything. Because we were on a loan repayment call yesterday for the state loan repayment program, and if one of our applicants is taking, receives a provider incentive to be in that community and they have a commitment, then we can't do loan repayment funds with them anymore. So I'm just making sure there's no hidden little thing in there, because eventually we're looking at CMS to help support these residencies for ongoing training costs, because that's the opportunity we would have and is probably what's built into everybody's sustainability plan. Okay. I see you nodding your head. Yes. So I guess we're okay. Thank you. Bye.
Thanks, Gerald. All right, one more call for questions. Oh, Mendy, I see your question in the chat. Will this PowerPoint deck be available shortly? Yes. We will get it remediated and posted. Should be by the end of the week. So we'll have that up for you. All right, guys. Well, thank you so much for joining today. Really appreciate your time. And again, we'll have the PowerPoint deck and the meeting recording available on our RHT meetings page. Hope you all have a great rest of your day. Thanks.